public, and there are a lot of questions, and the office has just been really overwhelmed in trying to respond to the public. So first, our main mission is to provide for the health and welfare of our residents. And we want everyone to know that at this point we have only been informed of one positive case of COVID-19 in Washington County. And Washington County, for those who do not know, is a fourth-class county. Being a fourth-class county, we do not have the authority to mandate closures of any businesses. We also do not have a Washington County Department of Health. We rely on the Pennsylvania Department of Health for all of our services. So the information we have is what we receive from the PA Department of Health. We have released all information we have received on the positive COVID-19. Another question we've been receiving is, why hasn't Washington County declared a state of emergency? We have 3 criteria for declaring a state of emergency in Washington County. If any one of the 3 criteria were to be met, we would then declare Washington County a state of emergency. One would be if funding would hinge on this declaration. We have been informed that it will not. 2 would be if we have confirmation that this disease had been contracted and is spreading in Washington County. We have no confirmation of that. And 3 would be if we receive confirmation that our health and human services support systems are overwhelmed. At this point, they are not.
Good afternoon. Washington County Commissioner Nick Sherman, Nicksherman. I wanted to call this press conference today because we're getting inundated with a lot of people in the area reaching out to us via Facebook and calling the office as what do we intend to do if the situation goes from bad to worse. We found that Washington County would be a great place to convene this meeting because many of you may not know that Washington County is the hub for what is called Region 13 for the Pennsylvania Department of Public Safety. This region is everything from Indiana County southwest down, so the whole southwest corner of Pennsylvania. Here at Washington County, we are the hub for public safety. Post 9/11, when we did our Department of Homeland Security, the feds allocated funding for everything from terrorist attacks to dirty bombs, and in this situation, where it's relevant for infectious disease control. So we have everything in this building that we can use for infectious disease control, such as a central command bus where we can have all communication, infectious disease control equipment. Should the disease start spreading more quickly, we can get ahead of it and get in front of it with this equipment. And last, we have the ability to do tents with quarantine. So we have taken the appropriate precautions where, again, if the situation goes from bad to worse, and our first responders stand ready to make sure that we are prepared. And I can tell the people, not only in Washington County, like I said, all this equipment that you see here in this hub is everything from Washington, Allegheny, Greene, Westmoreland County, so we do stand ready if need be. I'm going to now turn it over to our Public Department Director, Jeff Yates.
My name is Jeff Yates, Jeffyates, and Jeff Yates, Director of Public Safety for Washington County. So to let you know that the Washington County Department of Public Safety's Emergency Operations Center is open and functional and has been since Friday. During this time, we have been in constant communications with all of our municipal elected officials, keeping them apprised of what's been happening in the county, what our situation is, what our status is. We've also been surveying our emergency responders. At this point, there are some needs as far as N95s go. We can help out to an extent, and we've also placed unmet needs requests to PEMA looking for more equipment for them. We've also surveyed our hospitals. At this point, our hospitals are not having any issues as far as the surge goes. They're adequate in the emergency departments, and as far as the bed status goes in the hospital itself. So they are not being overwhelmed at this point. They're busy, but they're not overwhelmed. We just got a report that statewide, the number has jumped from 63 to 76. There are no additional cases here in Washington County. Again, we've been planning this or doing preparation for this for the last 2 months. We stand ready to assist anybody in any way they need. At this point, we'll open up for questions.
What can you say at this point about the active case? I mean, I know you said there's no emergency declaration because there's no evidence of it spreading widespread in Washington County right now. Have you isolated, kind of without divulging too much information to respect their privacy, have you isolated where this was? Is there some sort of investigation into who that person may have come in contact with? I mean, what can you say just about the active case in Washington County right now?
We have contacted the Pennsylvania Emergency Management Agency and gone through the Pennsylvania Department of Health. They will not release anything other than we have one case. The only other thing that they've told us is that that is not a community spread. They know there's a direct vector. They figured out the path as to how this person got it. Because that's not a community spread, that's one of the reasons that we're not doing a state of emergency. They can pinpoint how it went. That person is quarantined and isolated.
Yeah, there's a lot of people that call the office on that one. Sorry. There's a lot of people that have called the office on that one as well to ask questions about the one case that we do have. And as our director said, we don't know anything more than what they've told us. The people that call in are very frustrated, and I want them to know that we share in their frustrations. And we hope that soon the state will be able to release some information so we can keep people's worries at bay.
Can you go into the infectious disease control equipment one more time? You said
that's your baby.
There are vans and you said tents. Could you just explain a little bit more about that in the room?
Yes, we have protective clothing available to supplement our emergency responders or hospitals if necessary. One of the things that's come up is the possibility of drive-through testing clinics. We have equipment. We're set to do that. We have tents to do that. We can heat them, cool them, provide the appropriate level of protective clothing to the healthcare providers that would be doing the testing.
Jeff, last night Allegheny County leaders said they think in 2 to 3 weeks their hospitals could be overwhelmed. How many beds are available in Washington County, and do you fear that your hospital could be overwhelmed?
We don't have an exact bed count. We did not do that today. Just took the general. Are you okay? Are you overwhelmed? And no, they're stable at this point. We have no way of knowing. You look at it. Some of the data tells you that every person that's infected has the possibility to infect 2 more people, and away it goes. But the other side of that is, as we've looked at the dashboard with the counties, several of the counties have not had an increase. So it depends on how you look at it. We don't know. We're at anybody's mercy.
What? Go ahead.
Can you elaborate on your request into FEMA and talk about the case people at home don't know what an N95 is?
Yeah, N95s are essentially the masks that the healthcare providers wear to help prevent them from being infected through droplet. We also have requests for surgical masks to put over top of the patients so their exhaled air does not release anything that could potentially infect other people. There is a lot of that stuff here. There is stuff that people have in inventory because some are looking ahead. There are some of the services that are short. So basically what we've done is put a request into the State Emergency Management Agency stating that we don't have adequate supplies in some areas or for some people. They forward that to FEMA, the Federal Emergency Management Agency, and then hopefully that will come back down in the way of supplies for the people who need them if we can't meet their needs.
Commissioners, I've heard that basically the Department of Health claims it is hindered in revealing any more information because there's a law in the books that goes back to 1955 dealing with syphilis and typhoid cases. Have you lobbied if that is the case, have you lobbied your state legislators to quickly change this?
Yes, that's a conversation that we had with Senator Bartolotta on Saturday, and she's working to resolve that issue so that we can receive more information. In addition, we've also been working with a number of different organizations. We had via conference call meeting with the chairman of the Washington County Superintendents Association, talking about plans to ensure that children that are not in school that are receiving free breakfast and lunches, that would be made available to them. Also with aging services in Washington County and the area agency on aging, which they are suspending congregate meal programs in our senior centers, and we've also been in discussions with our housing authorities to determine if they would be able to limit visitors in the senior high-rises to only medical and food visitation.
Can you talk about
the Rivers Casino in Pittsburgh has suspended
You
operations.
want to do this one?
The Meadows continues to operate. You have no control over, as a county, to tell them to cease, but...
That is accurate. We share frustrations in Meadows Casino is not closing. We reached out to state leaders. This morning, Commissioner Ari Vaughn and myself called the Department of Gaming, and they assured us that by about 5 o'clock today that we will be closing Meadows Casino.
And that was after 4 conference calls that we had with them on yesterday, urging them to take it upon themselves to shut down operations. We're also trying to contact the owner of Tanger Outlets, and we're compiling a list of all large venues in Washington County so that we can reach out to them and share with them the guidelines that we're asking people to put in place.
This casino closure, is this all casinos statewide or just the Meadows? You're talking about 5 o'clock.
This is just the Meadows that we know of right now. It's obviously the only one in Washington County, and like I said, we have a large volume of calls coming in about that, wondering why. So we wanted to relay the message that we don't have the authority to do so. However, the county commissioners definitely applied pressure to make sure that it happened.
And it is closing at 5 o'clock.
It's closing today. Yes.
The PA game.
This
Gaming
is
Control Board.
Yeah, Pennsylvania Gaming Control Board.
Jeff said that you have equipment ready for drive-through tests. I think that's the #1 question that I'm getting from people. They want to know how many tests you have, when they can be tested, will they need a doctor's note to be tested, and will they be charged for the test?
Hey, everything that we've heard right now, the testing will be conducted through the Department of Health and the hospitals. Those tests aren't things that will come directly into our hands. They have not given us numbers. They have assured us they will have an adequate supply. We don't have all the information yet. We have a primary site, which will probably be the county fairgrounds. If we would have more than one site, we've got a couple other locations strategically located around the county where we could do multiples if that was necessary. And if that happens, we will share that information.
How many tests do you think have been done in Washington?
We have no way of knowing. We've asked, but we get no answers.
Is that frustrating?
Very.
Can you just talk again about, I know this is where you said all these Region 13 things are stored, but those resources are going to be dispersed out to other counties should they have, God forbid, an increase, right? These won't stay in Washington County.
Right. This is just a central location that we have for all this equipment. And like I said, I've been in for 3 months now. I'm not sure why the decision came. Probably geographically centrally located. And it was explained to me that they don't want to have this in downtown Pittsburgh because we want the ability, if something happens, to get to downtown Pittsburgh. But again, these resources are not just Washington County. It's the whole southwestern part of the state.
What are we not asking? What are people's concerns that you've heard that we might not have touched on, and what is the answer to those concerns? Is there something we're missing?
Well, let me interject for a second, and I'll give you the commissioner again. We are one of the main locations for Region 13, but all the counties in Region 13 do have equipment as well. So what we have here, a lot of this will be focused here within the county, but we stand ready to assist our neighbors, just like our neighbors stand ready to assist us. I said we've got a very good supply, but the other counties have equipment as well. We're not the only place that has it. I'm sorry.
Yeah. Okay. And then what are you hearing from constituents that? What are most of the questions around, and what are you telling them?
The questions have really centered around where is this confirmed case of COVID-19? And the second question is, when are you going to mandate the closure of many businesses, which we have no authority to do? So those are the bulk of our questions. There are questions, of course, of medical services. Where do I go to get tested? And we want to urge everyone that if they believe they could have contracted COVID-19, that they not go directly to a healthcare provider. They first call that healthcare provider so arrangements can be made to receive them once they get there with minimal exposure to the public and the staff.
Jeff, when you were talking about the hospital situation, don't they have a code red situation that's been in effect for years if they can no longer accept patients? And if there's a code red, does that mean there's also a code yellow and a code green? And if that is the case, how would you describe the 3 hospitals in Washington County?
Essentially, the way that goes, it's really just they're operational or they're code black. If they're code black, it means they can't take any more patients. Anybody who's going to be sent there on an emergency basis gets redirected to a different hospital. None of the hospitals are code black. They're open, they're functional. It's not really set up in a tiered form as you might think. The other thing about that, if all the hospitals go code black, then they all open back up again because there's no place else to send people.
If all three in the county go code black.
Then they open back up.
I've seen some senior life buses around town today. That's you know where that is up by the Wild Things.
Mm-hmm.
They're still transporting elderly people in and out of there. Is that something that you've addressed or have anything to, you may not have anything to do with that?
Not senior life, but we have been in communication with the Washington County Transportation Authority, Freedom First, and they are limiting rides to urgent medical appointments and also food visits and deliveries. So they're also taking precautions and cleaning down the buses. They're doing all they can. We recognize that people still need to get to critical appointments and we still need to have a supply of food. So we're focusing on public transportation being for those limited needs.
And at the senior centers and the lunches, did they begin distributing lunches today to go?
The plans that we discussed with protocols on Saturday are scheduled to begin tomorrow. And the Area Agency on Aging has taken the lead along with the boards of commissioners in our 3 counties that we work together with and the Aging Services of Washington County. So the protocols are in place and should go into effect tomorrow.
And just to clarify, when you talked about the state of emergency, the case in Washington County is a presumed positive, correct?
Right now they're saying positive. They've dropped the word presume on communications with us, so we are going forth with it. It is a positive case here in Washington County.
But then one of the criteria as far as declaring a state of emergency, so is there something that happens with that one case? If there's a CDC confirmation or whatever, would that change everything?
If we found out that this was contracted in the community, that would change our next step.
But what if they never tell you? What if it was?
Well, they have confirmed that it was not contracted in Washington County. That they have shared with us.
If another case pops up, who calls you?
Usually the Department of Health. It could be PEMA.
Yeah. Generally, it's the Department of Health notifies the Pennsylvania Emergency Management Agency, who in turn notifies us. And again, the only thing we get is the number of cases, no location, no gender, nothing. That's all they give us.
And as you probably know, there was some confusion last Friday over whether we actually had a presumptive positive in Washington County or not. There was information that had been relayed that there had been a mistake made, and it took us about an hour and a half to get a confirmation that we did have a presumptive positive after we started receiving calls from the media.
What kind of mistake?
There was a map that was shown with Washington County, then the map was withdrawn, and even on Saturday there was a press release that did not include Washington County. So again, on Saturday, our Director of Public Safety was reaching out to the Department of Health and PEMA, again, just to make sure that we did have the presumptive positive in Washington County.
Jeff, just to engage in this hypothetical, what's the bare minimum that you'd like to know just to help you out? I mean, is it simply the location? Is it the person's medical history? I mean, if there were to be changes that would help you, help people, what would that be?
Yeah, the biggest thing we would like to know is just the municipality. They will let us know if it's community spread or vector spread. If they can trace the vector, as they did with the positive we have right now, they know where that person was. It wasn't a community spread. Again, that feeds back into why we did not declare a state of emergency. That was not an unknown community spread.
Anything else?
Thanks for your time.
Thank you
Thanks for
guys
coming,
so
guys.
much. Thank you. Hopefully getting some of this information out will alleviate